Thank you. My name is Debbie. I have a question for the Minister, and thank you. First of all, I work in local government here at Parramatta, and I think there's several people from different councils here, and I think we're really pleased to see this forum happening and to have this opportunity to talk to you. Particularly wanted to ask the Minister, we have very close working relationships with our local health providers, with the growing relationships with the Medicare locals and already with the local health, I've forgotten the new name, sorry. But we're looking at the moment at the framework for the primary health strategy between the state and federal government, and we've been asked to make some comments to provide together to the state government about it. And one of the things that stands out for local government, we plan for our local area, and the social determinants of health and the prevention way back before the service delivery needs to happen is something that's really important to us. I'd like to ask whether you think you can engage your colleagues in infrastructure planning and in the other human services in the Cabinet in really strong social determinants of health-based planning with us to really get solid prevention planning going.
Thank you. There are 2 points to make in response to that, and thank you for it because it's a very important question. Somebody came up to me at the break and said the elephant in the room is the lack of integration with primary health care, and it is one of the great challenges because the New South Wales government is primarily responsible for hospital care and for community health services provided through New South Wales Health. But we need, in an integrated system, to provide much better linkages between primary health care providers and the acute and other settings. Yes, we're working, and the local health districts are working with the Medicare locals, and there's special work going on in some districts to get more models, demonstration models up so that we can show the advantages and the benefits of pooling resources and working together with primary health care providers. And I would add to that linkages with local government where they've particularly identified issues that can be addressed in a more comprehensive way. In terms of your question about engaging my colleagues, parliamentary cabinet colleagues, in social determinants of health, I smiled, you might have seen, because it sounded to me like that was a Dorothy Dixer set up by Stephen Leader over here, whose big deal is preventive health, and I'm with you, Stephen. It is, and we often talk about the impact of unmade footpaths and, roads that are not perfect and etc., lack of transport, lack of etc., housing on the health of a population. Stephen not only is the chair of the Western Sydney Local Health District, he's the chair of my Preventive Health Ministerial Task Force. And we've talked about coming up with some issues where we can, in small grabs, go to some of my colleagues and say, can we address some of these issues to demonstrate the benefit of working across government to address some of these social inequities that prevent people experiencing good health. Can I say we established the Office of Preventive Health within Liverpool Hospital in recognition of the needs of the community in Greater Western Sydney. In this case, we identified South Western Sydney, and they are already doing some wonderful work with schools and with children on breakfast programs and fitness programs and the like. So there is opportunity to do that kind of work. It will be limited in the first instance, but you'll find in the federal government there's a much greater interest and willingness to work across government agencies. And I'll just say, for example, I'm part of a ministerial task force on Aboriginal health, Aboriginal affairs. It's convened by the Minister for Aboriginal Affairs. It involves myself, Kevin Humphreys. It involves the Minister for Education, the Minister for Justice, so the Attorney General. It involves the Treasurer and many others. and we're working collectively to try and come up with some solutions to some of these problems that can't simply be solved by one portfolio. So that's a long-winded answer, but acknowledgement and recognition of the importance of working on the social determinants. Thank you.
Thank you, Minister. Minister Humphries would like to respond as well. Deb.
Thanks, Deb. Just to follow on from Jillian, I think yesterday was the meeting of the Premier's Council for Active and Healthy Living, and recently Jeff Hugel was appointed to that position, and part of that council's role over time is to also support what the Minister said in terms of planning and making sure that, I think when we had the Welcome to Country, that health and wellbeing is a very, very broad issue. It's not just necessarily a clinical issue. So you might hear a bit more from Jeff and that council over time.